In previous sessions, we have reviewed how the Affordable Care Act is going to transform various parts of the healthcare system. The delivery of care to patients, the insurers, employers, academic health centers, and medical education. It all comes together in the impact on healthcare inflation. So the last and sixth megatrend is the fact that healthcare inflation is going to decline, so that growth in healthcare costs is going to be at the growth of the economy and no more. When we transform the delivery of care, a number of things are going to happen. We're going to lower the price per unit of service delivery so that it's more efficiently delivered to patients. We're going to get rid of unnecessary tests and treatments that just add costs without improving care and outcomes. We're going to deliver VIP care to the chronically ill, keeping them healthy, making sure that they're functioning well, and if they get sick, moving them to the lowest cost site for the care, using digital medicine to monitor them out of the hospital, and making sure that we can deliver as much care as possible away from the hospital. Those trends in transforming the delivery system are going to be fueled by trends in the insurance marketplace. The exchange brings unremitting downward price pressure on hospitals and doctors because individual customers deciding what they want to buy in a marketplace inevitably gravitate to lower cost health insurance products. We've seen this in the exchange where 85% of people buy silver or bronze plan. Similarly, individual customers are not just going to be cost sensitive when they buy an insurance product, they're going to be more cost sensitive when they get healthcare services because of the rise in deductibles, co-pays, and co-insurance. So they are going to actually be shopping much more prudently. And the result is going to be a big, important demand for price transparency and quality transparency. People are going to want to know, this delivery of service, is it cheap because it's not very good quality? Or is it cheap because it's a good bargain? It delivers high quality at a low cost. And we've already seen an expansion of companies responding to that demand, getting price and quality transparency out there. Finally, integrated delivery systems are going to fuel this sensitivity to trying to get high quality, low cost healthcare. Because an integrated delivery system that integrates across the continuum of care and integrates care with insurance functions basically gets a premium dollar every month and has to deliver all of care. The difference between the cost of care they deliver and the premium dollar is their margin or profit. So they will use a lot of techniques to actually reduce the cost of care that they deliver. That emphasis on higher quality, lower cost is going to reverberate throughout the system to the drug companies, the device manufacturers, the makers of MRI machines, and others, because they know that doctors and hospitals are going to be making decisions on whether they deliver a high quality at a low price or not. They're going to decide whether to invest in a drug or a new device based on different items. If we actually can get healthcare under control, that will be historic. As you can see from this graph, for the last 50 years, healthcare costs have been rising faster than the underlying growth in the economy. In the early 1960s, healthcare costs were under 6% of the whole economy. Today, they're just about 18%. Every year, healthcare costs have been going up at what economists call GDP plus 2% on average. Can we actually get to GDP plus 0% growth of healthcare costs with growth of the economy? It's a big challenge. It's not guaranteed. But as President Kennedy said when discussing the decision to go to the moon, he said, "We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills. Because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one which we intend to win, and the others too." These kind of big goals, like having healthcare costs grow at the rate of the economy and no faster, are a big challenge, but they focus all our other energies in transforming the delivery system, having the exchanges work to get efficient and low-cost services to people very well. It's not guaranteed, but it is a very important goal. Imagine if we did get healthcare inflation under control so it grew no faster than the economy. Well, first, it would be very, very valuable for government. We'd save billions of dollars at both the state government level and the federal government level, allowing investment in education, primary and secondary school education, increasing support for state universities, allow investment in infrastructure and research. And for employers, having healthcare inflation under control would also have major impact. They could actually increase wages and not spend so much on the fringe benefit of healthcare. And long term for the country as a whole, getting healthcare costs under control would be very important. It would mean that we could reform taxes and entitlement without so much pain. And it would have a major impact on the long-term deficit. Almost all of the long-term deficit is a result of healthcare cost growth. As this slide shows, if we can get healthcare inflation to GDP plus zero, it has more than $1 trillion effect on the deficit, moving from a big deficit to a surplus in the mid-2030s. Can we do it? It's not guaranteed, as I said. But with passage of the Affordable Care Act, healthcare cost growth has actually moderated over the last 4 years. We need to do more, and we need to really transform the delivery system completely. But I think once we do that, we can get healthcare cost control under our belt and get to megatrend 6, healthcare inflation and growth in the economy.